Last week we did an update from every region. So in Korea, the two big things that are happening over there, Hira, their, as you can see here, administrative claim system has now been converted to the OMOP CDM. It's not readily, widely available yet, but they are working on figuring out how to make that accessible to folks in Korea as well as outside of Korea. And then we also have one of the larger hospital chains join us in converting their data over to the OMOP CDM, and that's the Severance hospital chain that you see here. You can go to the next slide. So China, we did some organizational changes to go with the direction of the 3 different OKRs that we have there. We have 3 different folks managing them directly in China. So one on training and engagements, one's on methodology, and the other on clinical studies. I want to talk very quickly about 2 of them. One of them is the methods and tools, which is in the next slide, where we are actually spending more time on updating the vocabulary within China. So 2 years ago, we released the first version of ICD-10-CN, which maps up to the 4 digits inside the WHO version. But now we're going all the way down to the 6 digits to try to get those to map up to the right ones, or even talk to the vocabulary team about how to include them. The second work that's happening right now was inside the tools and methods. There is a group in China that is converting one of the cancer registries that they have over there over into OMOP. And we're actually going to have them also present at the Asia Pacific community call in one of the coming ones. So if you guys are interested in hearing how they are working on oncology, feel free to let me know and we'll tell you when that happens. If you can go to the next slide. Japan, we have folks over there working on vocabulary as well, where there's a group that is looking at their drug mapping to see whether or not how to map all those over. There are few folks that are actually working on some of their claims data assets and moving that over to OMOP, but that's not done yet, so they didn't want to talk about that. If you go to the next slide. Taiwan. So Taiwan has 3 goals, same thing. Number 1 is to set up a website. They're almost there. As you can see there, there's a draft version of their website. Their 3rd goal is actually to build out the Taipei Medical University's CDM or data into CDM. So they've done that and they've actually completed that earlier this year. I skipped goal number 2 because goal number 2 is on the next page. So goal number 2 is really to try to interact with other universities in Taiwan. And as you can see here, there's been interaction with 6 other universities with a meeting, as you can see, on March 16th, 2021 with this Chai Christian Hospital. I did ask the question, how complex or how is it going? How is it that they're able to connect to all these different universities? And the answer I got was, it's not easy. But because of some of the relationship between the hospitals, it made it a little bit simpler to be able to do some of that. So there's a lot of effort within the Taipei Medical University, all the way up to their deans and their presidents to talk to these other hospitals and the benefits of OMOP. So that they're spending quite a bit of time on helping to get more universities and hospitals in Taiwan onto the OHDSI network. If you can go to the next slide, please. Australia, there is a lot going on in Australia. So there are 3 goals. One is to do 4 to 5 OMOP conversions. And you can see here, they are actively doing that with both primary care, secondary care, and administrative claims. I won't go through all of this, but if you can go to the next page, just some high-level statistics on the administrative claims, the pharmaceutical beneficial scheme, which is about 10% of their dispensed medicine. They successfully converted that over to the OMOP CDM model. And you can see some statistics here on what data is available, the number of patients, and the number of records that they've been able to convert over the standardized drug concepts. If you go to the next slide, their second goal is to do collaboration, is to do 1 to 2 paper. And they have been, again, working on that. They're part of the COVID-19 working group. I know it's no longer around, but they're still working on a lot of that work. They've already they have one study that's published and others that are under review. They're also part of the hypertension project, although all 6 countries or chapters are also part of that. But there are others that are going on. If you can go to the last one, their third goal is to bring higher data quality into the OMOP conversions that they're doing. So they've been working on trying to extend some of these data quality assessments and better understand them. So Claire, maybe what you guys are doing may be beneficial on the data quality dashboard for these folks. So they're spending a lot of time doing that. Last one, if you can go to the last one, is if you guys have an interest in joining the Australia webinar, it is this Thursday on the 29th April at 2 p.m. Australian Standard Time. So you have to revert that. I think it's midnight for most of you guys on the East Coast. For us on the West Coast, I think it's 9 p.m. But it is to talk about how they're using the oncology extension. So if you guys have an interest, please let us know and we can forward the invitation to you or go to their website. If you can go to the next one. So last but not least, we have Singapore. And what they're doing is they're collaborating with a AI platform over there to build a federated learning model. And underneath this federated learning model is the OMOP CDM. If you can go to the next page, you can see here, basically it's a model as well as they're trying to get the data. And what they've decided is if we use a standard common data model, it would be great. The other thing that wasn't actually a slide on was that the National University of Singapore has been able to work with their Ministry of Health and convince the Ministry of Health to utilize the OMOP CDM as their overall platform for research. So that was just announced. They're starting to work on that. Therefore, we don't have a slide on it, but there is a lot of activity going on there. And I asked the question, how did you guys convince the Ministry of Health, right? So it took a lot of talking to, a lot of showing them how things could be done, not just within Singapore, but how things are operating outside of Singapore and all the other different governments that have adapted to it. So they spent a lot of time working with the government there. And then the last shout out that they want me to let you guys know about is this Singapore Healthcare AI Datathon. If anyone is interested, feel free to join. It really is a group of physicians as well as data scientists around the world coming together to do something as a group for the week. So that's my quick update from Asia Pacific.